man is diagnosed with one of the deadliest cancers known to medicine. Doctors give him months to live. Then something unexpected happens. Not a new chemotherapy, not a clinical trial, not an experimental hospital treatment. He starts taking a dog dewormer, and according to his story, his cancer disappears. No, this isn't fiction. This is the claim that sparked a global controversy. A drug called Fenbendazole is now being called a hidden cure. But here's the real question. Did we just overlook a breakthrough? Or are people being misled by something far more dangerous? Imagine hearing this as a cancer patient. There's a cheap drug, already available, that might work. No billion-dollar price tag. No waiting years for approval. No complex access barriers. Just a simple compound sitting quietly in veterinary medicine. That idea alone is powerful, because it challenges something deeper. What if the cure already exists, and we just haven't been looking in the right place? This is how Fenbendazole enters the conversation. Not as a drug, but as a possibility. The name that keeps coming up is Joe Tippins, diagnosed with advanced small cell lung cancer. Prognosis? Grim. But then comes a turning point. He hears about Fenbendazole. He starts taking it alongside other supplements. Months later, scans reportedly show no evidence of disease. He shares his protocol online. And within months, thousands are reading it. Within years, millions. His story becomes something bigger than himself. It becomes proof, at least to those who want to believe. But here's the uncomfortable truth. A single story can inspire hope and still be scientifically incomplete. Now here's where this gets complicated. Fenbendazole isn't just random. It works by targeting microtubules, structures that cells need to divide. And cancer? Cancer is uncontrolled cell division. In fact, some of the most effective chemotherapy drugs do exactly this. They disrupt microtubules. So suddenly, this isn't just a wild theory. It's biologically plausible. Lab studies have even shown that Fenbendazole can disrupt cancer cell growth, affect glucose metabolism, trigger cell death pathways. On the surface, it starts to look legitimate. But there's a critical line most people don't see. Plausible does not mean proven. Let's slow this down, because this is where many people get misled. When you hear, studies show it works, you might assume that means human trials. It usually doesn't. Most of the data on Fenbendazole comes from cell cultures, animal studies, early-stage experiments. And here's the harsh reality of drug development. Over 90% of drugs that look promising in early research fail in human trials. Why? Because the human body is not a petri dish. It's infinitely more complex. So while Fenbendazole may affect cancer cells in a lab, we don't know if it can safely and effectively treat cancer in humans. That gap is everything. Now let's talk about what's rarely emphasized. Risk. Fenbendazole is not approved for human use. That means no standardized dosing, no long-term safety data, no regulated manufacturing for human consumption. Some patients are taking veterinary-grade products, designed for animals with completely different biology. And here's the real danger, not just side effects, but substitution. When patients begin to trust unproven treatments, they may delay or abandon therapies that are actually proven to extend life. And in oncology, timing is everything. So why does this idea spread so powerfully? Because it taps into something deeply human: control. Cancer takes control away. Treatment plans are complex. Outcomes are uncertain. But a simple alternative? That gives people something back. Add to that a compelling survivor story. Online communities reinforcing belief, distrust in pharmaceutical systems. And suddenly, Fenbendazole isn't just skepticism turns into suspicion. It becomes a movement. Some people ask, if this works, why isn't it being studied more? It's a fair question. Fenbendazole is off patent. It's cheap. There's little financial incentive to fund large-scale trials. And that creates a vacuum. Where evidence is missing, speculation grows. But absence of evidence is not proof of suppression. Sometimes, it's just absence of evidence. Most oncologists are not dismissive, they're cautious, because they've seen this pattern before. Promising compound, early excitement, public hype, then failure in clinical trials. They don't reject fenbendazole because it's impossible. They reject the claims because they are unverified. In medicine, that distinction matters. There's a line that shouldn't be crossed. Exploring new ideas? That's science. Promoting unproven treatments as cures? That's something else. Because when hope is marketed without evidence, it stops being hope. It becomes risk. So what is fenbendazole? A miracle cure? No. A complete scam? Not exactly. It's something far more complicated. A scientifically interesting compound, trapped inside a narrative that moved faster than the evidence. Right now, it lives in uncertainty. And in medicine, uncertainty demands caution, not conclusions. The history of medicine is filled with unexpected discoveries. Some of them came from unlikely places. So could fenbendazole one day prove useful? Maybe. But until that day comes, truth must be separated from belief. Because in the fight against cancer, what we want to be true is not the same as what is true.